Welcome to Talk 1260. This is Western Medicine. This is Dr. Daniel Ronel with my wife Betsy. We're going to talk about plastic surgery, the reality behind what's going on in plastic surgery. We've got a great show today. We're going to talk about men. That's the focus. We've got a nutritional tip coming up. And
we're talking about anti-aging and nutrition as well.
Yes, yes. Okay, so
let's get it started. All right, so Daniel, you know, I have some aggression towards men, but I like them very much. I'm married to one, and I have 2 sons. But you know, the bigger they come, the harder they fall. So how do they do in plastic surgery?
It's a very funny question.
It's a general question. I'll get more specific. But
yeah, okay. In fact, I think women sail through plastic surgery a lot easier than men do.
Darn right we do.
Right. You've got to deal with childbirth. You've got to deal with a lot of gore with your children growing up while we're away at work.
Our bodies every single month.
Yeah, and so I find that you know, men sometimes have difficulty recovering from plastic surgery compared to women, but for the most part, I find it very easy to talk to a man because I can just tell them this is how it's going to be.
You people are more matter of fact. People.
It's funny, I have a lot of police officers who come to me for liposuction because they work out and they are in great shape, but genetics makes it difficult to get rid of that, some of that fat right around the midsection, and so we do liposuction there.
Okay, so starting with that, that's a good send-off here. What are some of the most popular areas that the Manx come in for liposuction?
Number one is the breasts, actually.
Oh, really?
Because, right,
there's
a condition called gynecomastia, which is sort of an overdevelopment of the male breast.
It's a very sensitive topic with the Manx.
It is, and it's it can be embarrassing in the locker room, at the beach, it can start in puberty, you know, and so I do a gynecomastia reduction in kids who are 14. I just did one.
Of course.
Right,
that's
all the way to the older adult, and it can be either done with liposuction or surgery or a combination of both.
And it just depends on how large the breast tissue is.
And you have to look for the causes of it. There are some rare causes of gynecomastia, such as testicular tumors or endocrine problems, certain medications like for ulcers or high blood pressure, and marijuana smoking.
Marijuana smoking?
Yes, that's a big one. So once all those things are ruled out, then you can proceed with surgery.
I mean,
it's very effective.
Yeah, I'm sure. Okay, so gynecomastia.
So gynecomastia is a big one. Obviously, reducing the fat around the waist.
The penis.
If it's really big, then you have to do a tummy tuck, but liposuction is a good option for some men.
Really?
I get asked a lot about hair transplants, and I used to do those, but I've gotten away from them because they take up a lot of time. You have to basically do only that. And,
yeah, these people have those centers for those. Yeah.
And those centers are great. The Bosley Center is a very good center.
Oh, yeah.
And there are some people who do just that, and that's where I would go for those. There's
right, and you refer people out.
Right, there's currently nobody in the state of New Mexico who does that.
It's funny because I don't know about other women, but I myself don't find baldness offensive. I know men have their personal issues, and women have their personal issues.
Just take a look at me.
Right. If you haven't seen big old Dr. Ronel, he's pretty bald. But and he was when I met him. But you know, but it's not. If you have a nice shaved head and a nice face, you're good to go. It doesn't matter if you got hair or not.
Yeah. I'm getting a lot of realtors who are coming in. Yeah, in this market, especially Santa Fe, seems to have a very high turnover of houses because there's so many second homes and third homes here, and so there's tons of realtors. And when you're out there face to face talking to people, trying to convince them of something, number one, you need to feel good about yourself.
Well, it's a salesman job. You must look good.
Right. I mean, we just ran into a realtor the other day, a couple weeks ago.
You can't say their name, obviously.
Right. Anyway, he's a good-looking guy, you know, and I would buy a house from him.
I don't know who you're talking about, but you know, it's funny, right before the show started, the three of us in here were talking about how most realtors aren't quite attractive.
Yes.
Because they have to keep themselves well. So,
and so
Santa Fe realtors, you're doing your work. Good job, and thank you.
And so that's a big segment of my male population.
Oh, really?
Right, who just want, for example, you know, their eyes refreshed, or even a little filler in their cheeks or something, just to make them not, you know, so. Yeah, I guess they feel more competitive in the workplace when they get that sort of thing.
I think that men in any industry now are, or have been, starting to feel the pressure of their looks, passing away, aging away, and they are. I mean, you've heard about this for years in the news, for the past few years in the news, that men are coming in for more and more work.
That's the other big one, is news reporters, actually.
Oh, well, I'm sure,
Because now they're on high definition TV,
right,
so all their old little blemishes and molds, they're not so much coming in for a whole facial rejuvenation, but they've got a little scar or a blemish or something that they would like excised or zapped off.
We have good-looking news people though in this state, men and women. They're nice looking.
Yes, we do.
But okay. So wait. So you mentioned before fillers in the cheeks. What about nasolabial folds? That's a big thing for women. Is it as big for men?
No, it is for men too. Right, because that's a telltale sign of aging, is how deep the folds are between your nose and your lip, the nasolabial folds. Some people call them the parentheses.
Right.
And especially on the left, you know why?
Why?
Because it's the driving side.
On the left side, right.
Yeah, the left side of the face, almost always, and
right.
in England it's the opposite.
Oh, that's funny, okay. Now what about, you know how everybody's nose droops as they get older, men and women? Do men come in for that?
Yeah, they do. And
does it get filled in, or do you do a nose lift?
You can do, it's a good question, you can do a non-surgical rhinoplasty with a filler, and you can't get as dramatic results as with a true rhinoplasty, but it's amazing. Every time I do one, I'm just amazed by how much I can lift a tip or fill in a hump. With just a filler, it's just a 15-minute procedure. It doesn't last forever, but it's a short procedure. But the rhinoplasties...
And you do that in the office,
right? Yes,
right?
you do that in the office, right. And, but the true nose job, obviously, is a bigger deal, and that makes a more dramatic change.
Yeah, well, that's if you can take time off. I mean, the nose thing, the injection is just a day in, day out, and you're bruising, it's over.
Righto.
So, okay, so what else? What else do they come in? I mean, when a man comes in, is he coming in because he's gotten divorced? Is he coming in for the same reasons that women come in? I know you've mentioned career.
Yeah, career's a big one, but no. First of all, men aren't as forthcoming with why they're there.
Oh, really?
So they're not chatty.
Do you just sit there? Dum, 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 dum. So.
I'd say the reasons they're coming in is because, like I said, they want to look younger or fresher. A lot of them are getting laser facial rejuvenation to get rid of some of the wrinkles and sun damage. Yeah, because that's a very easy procedure. And Marion, who's been on the show before, she's very coddling and she's very comforting.
Yeah, you feel like you're in your mother's bosom.
I think men really like when they see her.
They like that Gina. I'm sure they do.
Right. So
but she ain't hard on the eyes,
Yeah. So those are the main reasons men come in.
So okay. Quick recap. So it's mainly what areas of the body that are the most popular that men come to you for?
Number 1 is breast. Number 2 is the midsection. Number 3 is face.
Are they coming? One quick question about the midsection. Are they coming to you for more sculpted abs, or love handle removal, or what?
It's both. I'm seeing much more of love handle removal and just people who are a little overweight. Than the very trim and fit people who want the very specific procedure called liposculpture, which is when you can actually create a six-pack. And that's actually that's actually a very difficult procedure. And if you do it wrong, you can end up with a 7-pack. That looks very unnatural, right? So
there's a joke in there somewhere, but we're running out of time. All right. So that's our first segment. And now our show, Western Medicine, is proudly sponsored by Artifill, a fabulous filler company, which I shall be sampling shortly. Thank you so much for listening. We'll be right back with Mark Wood and his nutritional tip.